As the coronavirus slams Houston hospitals, it's like a New York all over again. Written by the New York Times, the death toll is lower, but there are echoes of March as cases spike. Doctors feel ill and supplies run short. Now, Texas is trying to adapt hard-won lessons while addressing a new set of challenges. Written by the Sheriff Fink, July 4th, 2020. Houston. Over the past week, Dr. Eric Bakshi, an emergency physician at Houston Methodist, had to decide which coronavirus patients he should admit to the increasingly busy hospital and which he could safely send home. To discuss questions like these, he has turned to doctors at hospitals where he trained in New York City that were overwhelmed by the coronavirus this spring. Now their situation are reversed. Thumbing through a dog-eared notebook during a recent shift, Dr. Bakshi counted about a dozen people he had treated for coronavirus symptoms. His colleagues in Houston had attended to many more. Meanwhile, friends at Elmhurst Hospital in Queens told him that their emergency department was seeing only or two virus patients a day. The surge is here, Dr. Bekshi said, as the Houston hospital faced the worst outbreak of the virus in Texas. Now one of the nation's hot zones, Dr. Bekshi and the others are experiencing some of the same challenges that their New York counterparts did just a few months ago and are trying to adapt to some lessons from that crisis. Like in New York City in March, the Houston hospitals are experiencing a steep rise in case loads that is filing their beds, stretching their staffing, creating a backlog in testing and limiting the availability of other medical services. Attempts to buy more supplies, including certain protective gear, vital sign monitors, and testing components, are frustrated by weeks of delays, according to the hospital leaders. Methodist is swiftly expanding capacity and hiring more staff, including local nurses who had left their jobs to work in New York when the city's hospitals were pummeled. A bad until you have a staff, said Avery Taylor, the nurse manager of coronavirus until created just outside Houston in March. But with the virus raging across the region, medical workers are falling ill. Dr. Bakshi was one of the first Methodists to have COVID-19, getting it in early March. As of this past week, the number of the nurses being hired to help open new units would only replace those out sick. Methodist, a top-ranked system of 8 hospitals, had nearly 400 coronavirus inpatients last Sunday. Nearly a week later, even as the physicians try to be conservative in admitting patients and discharge others as soon as they safely could, the figure was 569. The flagship hospital added 130 inpatient beds in recent days and rapidly filled them. Now, administrators estimated that the number of the COVID-19 patients across the system could reach 800 or 900 in coming weeks, and they are planning to accommodate up to 1,000.